like everybody to take a look at this beautiful baby girl. Now imagine a group of women getting together, holding her down, and forcefully, excruciatingly, without anesthesia, removing her female external genitalia. This happens every day in the world. This is called female genital mutilation, also known as FGM. 2 million girls each year are a victim of this. My name is Robin. FGM is a global issue, and it affects society as a whole. I've read many articles and even done a research paper on FGM last semester. Every day there are countless TV stories where you can watch the horrors of the victims and the survivors of FGM. Today I'm going to give you information about FGM. I'll share with you exactly what FGM is, where and why it's practiced, and problems that can arise from FGM. As we start, we may wonder, what exactly is FGM? FGM is a cultural practice of totally or partially removing the female genitalia. The existing tissue is then sewn together. Most of the time, the FGM is performed by women in the community. They have no medical background, they use no sterilization, and it is performed by laying the little girls down and forcing it on them. They have no choice. Females as young as newborns can have this done, and it goes up to 14 years old, but it's always done prepubescent. It's estimated that 90% of Egyptian girls are cut between the ages of 5 and 14 years old. In Yemen, 75% of girls are cut before they're even 2 weeks old. That information was found on womenshealth.gov. As we think about what it is, let's think about where and why it's practiced. As mentioned earlier, it is a cultural practice. It's predominant in Africa, Sahara, and the Middle East. It is not a religious practice, but a cultural practice. Those who practice it believe many things. Some of them believe that females are unclean and that the female clitoris is actually dangerous to men and to newborns. They also believe that by performing the FGM, that females will remain a virgin until marriage, and that once in marriage, they will remain faithful to their husbands. This information about where and why it's practiced was found on worldhealthorganization.org. Now that we know where and why it's practiced, we have to think about what can be some of the long-term issues of when it is practiced. There's many complications that can arise, and I made a list for you guys. This list was found on worldhealth.org. It was also conducted in my research paper that I did, and also on religioustolerance.org. So as we look at some of the problems, there's bleeding or hemorrhaging, and that's because there is no anesthesia and there is no topical ointment placed on there. The little girls receive infections almost all the time because of this procedure. Obviously there's pain, and the pain isn't worse the day of, it's the day after when the little girls have to go and urinate. Trauma from being held down and not understanding what's happening to them. Some of the long-term effects that we find, because of the size of the hole that's left for the little girls, sometimes they have problems going to the restroom. They aren't able to have a normal sexual relationship with their husband. They can have gynecological problems. Those who have experienced FGM are not able to have normal pelvic and pap smears because the tools don't fit these women. In addition to these other long-term risks, they all run a very high risk of obtaining HIV and other venereal diseases because the same tools are used on many, many girls. They also have problems getting pregnant during the pregnancy and delivery. Most of the pregnancies have to be delivered via C-section. Along with all of these, there's also psychological and emotional stress. I've enjoyed sharing all of this information with you, even though it's gut-wrenching and it touches all of our hearts. FGM is a global issue. I've informed you what FGM is, where and why it's practiced, and problems that can arise from FGM. We must remember that as our world becomes more integrated and societies and cultures are blending, that FGM isn't just a global issue that happens over in Africa. The time is not so far away when it could be in Oklahoma or where you live on the World Wide Web. The next time that you hear or see an article in a newspaper or something on TV about FGM, I urge you to really take a look at it and consider what's going on with these young girls and ask yourself if it's a global issue, a cultural issue, or a society issue. I want you guys to know I appreciate all of your time. Thank you.